House Majority Leader Steny from Maryland's 5th District joins us now live from Capitol Hill with more on this and other issues facing lawmakers. Good morning to you.
Good morning, Allison. Good to be with you.
It is our pleasure to have you here, sir. Let's start with the debate here at home. We're talking about health care, and at 10 this morning we talked about it. The Senate's Finance Committee will meet to determine whether it should offer, meaning the government, its own health insurance plan to middle-class families. Tell us more about this proposal.
Well, on the Senate side, as you say, they will be offering a proposal for the so-called public option. That is an option that will be available to people if they can't find insurance either on the exchange that suits them and they can afford, so they'll have an alternative. The Senate has not included that in its Senate Finance bill, and they'll be marking up still. It's been ongoing to see whether or not the majority of the Finance Committee will agree to that. We'll see. In the House of Representatives, I think there's broad agreement within the Democratic Party, certainly, that a public option is a very important alternative, which will help to be a more competitive environment, bring prices down, and assure availability of insurance for individuals and businesses and families.
And, excuse me, sir, the public option also remains a top option for liberals, thus pitting, in essence, liberals and moderates against each other in the same party. Can we expect to get anywhere with this sort of, I guess, factioning off of different groups? Well,
Allison, first of all, let me say that I think there are a number of moderates who support a public option, and they support a public option that is on an even playing field with private sector options. So I'm not sure that it's just liberals, but in any event, clearly there is a broad agreement in the House that that's a necessary and appropriate option. We'll see what the Senate does and take it from there.
We just talked about that one poll that showed the public waning a bit in their support for this. Does that work against lawmakers in our land if the public doesn't seem to be behind this the more time that goes by with this health care debate?
Well, I certainly think the Congress is a representative body, both the Senate and the House, and so they want to reflect the views of the American public. On the other hand, the views of the American public have clearly expressed over a long period of time that we need to reform the health care system. They know it's not working as it should. They know there are an awful lot of people who are not covered, and they know that they're paying for those people, and those people aren't participating in helping to pay for their own health care. Families are seeing their premiums go up by $1,800 a year. They're losing their insurance as a result. They know that's not a system that can be sustainable over the long haul, and then they know the costs for the government and for themselves are out of control. So I think they know there needs to be reform. I think they are a lot of anxiousness about what that reform is going to mean and what it's going to mean to them. So we have a lot of education yet to do.
Let's talk about some international matters that have been front and center on the news. First up, Iran. On Thursday, a couple of days from now in Geneva, we are set to see those talks with the Iran and representatives of major powers, including the United States. These talks could be very important. We're talking about very hefty sanctions. What do you believe could be the outcome of these talks if they're not what the international body wants to hear from Iran?
Well, I think Iran's admission just recently, just a few days ago, of a secret nuclear plant that they are burying into a mountain certainly does not seem to be for peaceful purposes. And I don't think anybody in the world believes Iran when it says it doesn't want to produce nuclear weapons devices. As a result, the world has passed resolutions saying this is not appropriate, you should not proceed, we're going to impose sanctions. In fact, sanctions have been imposed. But I think if these talks do not go positively, if Iran does not agree to prove what it says it wants to do and only pursue peaceful means and allow the International Atomic Energy Commission's inspectors in to see that, I think you're going to see very, very tough sanctions being pursued, not only by the international community, but certainly by the United States.
Let's talk also about Afghanistan, sir. Some are calling this decision in Afghanistan, what we're on the cusp of a decision, a defining moment in the Obama administration, young though it is. He's getting advice from his top military commanders. We need more troops there on the ground. And yet this would seem to alienate a very big base of supporters for the president. Where do you believe we need to stand on this issue, sir?
I think the president is pursuing this as he should. in a very thoughtful, considered manner, hearing from all of his advisors, the military advisors, his State Department advisors, and discussing it as well with our allies who are there on the ground with us in Afghanistan. Clearly, the president has stated for a long period of time during the campaign and since his election as president that the base of terrorism was located in Afghanistan. The attack on the United States was formulated and initiated from Afghanistan, and that's where he believes the fight against terrorism is. On the other hand, we know we are not succeeding. Unfortunately, we took our eye off the ball for many years, and the president is now trying to see what is our best policy to move forward there. What can we do? What can we do to succeed? I'm personally waiting to hear from General McChrystal. I hope he comes over to the United States and testifies before the Congress in the near term, certainly before we make this decision.
House Majority Leader Representative Steny Hoyer, thank you for spending some time with us, sir.
Thank you very much.
Okay.
It's 8:30.